to the panel. Chair recognizes Amanda Cole, Kay Sanders, and John Deese. And after that, it will be Mark Mackey, Stephen Powell, and Dr. Helman-Niak. Amanda, go first.
Good morning, and thank you for allowing me the opportunity to speak in opposition of Senate Bill 1794 today. My name is Amanda Cole, and I am a constituent of Representative Sarah Davis's. I'm also a full-time graduate student at the University of Texas Health Science Center at Houston, working towards my doctorate of nursing practice in nurse anesthesia. Before I became a graduate student, I earned my Bachelor's of Science in Nursing, and I worked as an ICU nurse for 4.5 years. During this time, I was responsible for providing high-quality, direct patient care to critically ill individuals suffering from an extensive array of complex disease processes. These 4.5 years provided me with an ability to perceive and interpret subtle changes in my patients' vital signs, assess alterations in levels of consciousness, and anticipate minor conditions before they had an opportunity to become major ones. It was absolutely imperative that I had refined my clinical judgment and clinical competency prior to initiating my anesthesia education. Without this invaluable experience, I could not have built the foundation of knowledge and prerequisite skills that are vital to the delivering safe anesthesia care. The educational route is quite different for anesthesiologist assistants. Prior to starting their training, these individuals are not required to have ever set foot in an ICU, let alone laid hands on a patient. A significant amount of time that these students spend in the clinical setting is spent teaching them basic skills, such as how to conduct a head-to-toe assessment or take a patient history. These are things that registered nurses have already mastered during their undergraduate education, and their lack of clinical expertise poses a direct threat to patient safety. And that's why I'm here today, because patient safety is the ultimate focus, and it's a shared responsibility among all healthcare providers. So it's my obligation to express to you my genuine concerns regarding licensure of these assistants. Licensure of an individual imparts a certain degree of legitimacy and proficiency, which anesthesiologist assistants simply do not have.
Thank you very much for your testimony.
I'd like one more thing to say. There's no other circumstance in which a person is more vulnerable than when they are under the care of an anesthesia provider.
And witnesses, and that's why we have to run a strict time for the witnesses. Okay, Kay?
My name is Kay